Good afternoon. My name is Angie Juzang, and I am a co-founder and board member of the Legacy Business League, which is designed to help minority professionals and business owners with sharing information and resources to help them both professionally and personally grow. We would like to network, empower, and develop with those who are interested in our mission, which is to really leave a legacy for those that are coming up behind us, those professionals who have had the opportunity to capitalize on the hard work of our ancestors that came before us. And our focus and mission is minorities, but anybody is welcome to join and listen into the topics and information that we present. Over the last several months, actually since March, we've been able to cover many topics, from politics to speaking to the chief of police to finances. And today we are going to talk about health, because that is something in our community that we want to keep top of mind. It is Breast Cancer Awareness Month, and 1 in 8 women will get breast cancer in their lifetime. While the rate of getting breast cancer is the same, virtually the same for women of color and non-women of color, 40% higher among Black women than white women is the mortality rate. They die at a higher rate. So it's very important for us to be able to talk about early detection, screening, and some tools and resources that one can use to take control of their health. And so today we have Karen Sock, who has been a blessing to me in my life. She's definitely a mentor, if not a self-proclaimed one on my end, where I just have watched her throughout the years, and she's such an inspiration. She's a community leader, thought leader, change agent, as well as has led some of the largest industries on the Mississippi Gulf Coast and throughout her career. In addition to helping launch Pathways to Possibilities, which is changing the culture of how children choose their job and careers, and has very high measurable results. But Karen is also a breast cancer survivor and is currently living with metastatic breast cancer. So I'm going to let her tell a little bit more about herself. And in just a few minutes, after we've talked to Karen for a little bit, we're going to speak to Catherine Young, who is the Senior Vice President for Susan G. Komen, which and she services this area, and she can tell us a little bit about the resources that are available to people in this area. So welcome, Karen. Thank you so much for being with us here today. So
Thank you. Thank you, Angie.
About yourself, for people who don't know who you are, and I don't know who strange people be, just tell us who you are.
Well, you gave a great overview, but I'm originally from Cleveland, Ohio, and I came to the Mississippi Gulf Coast in 2005, 10 weeks before Hurricane Katrina, and I fell in love with the community here, and I've been here ever since. I've been married for 33 years. We have 1 adult daughter, and I live here in Biloxi, and I'm a happy camper.
Okay, well, very good, and I'm so glad that you're here today. Tell us a little about your breast cancer, your journey, if that's the right word to use. You know, how did you find out you had breast cancer, and where are you now?
I was in the shower in the fall of 2010, and I was just taking a shower, and I felt a lump under my right breast. It felt kind of gristly, like the end of a chicken bone. And so I thought, I better make an appointment to get a mammogram. So I made 2 appointments and I canceled them. And then my husband and daughter insisted that I go and have my mammogram. So it's just before Christmas that I went and when we got finished, the tech had this funny look on her face, and she said, "If you'll just sit here, I'll go and get the doctor." So I figured something wasn't right. So he called me in and showed me on the screen the X-ray, and he said, "This is unusual. I don't know if it's solid. I don't know if it has liquid in it, but I think we need to have it removed." So right after the first of the year, they took the lump out, and he said that the lump was about 2 centimeters in diameter. And about a day later, I got a call from the doctor that said, "Karen, unfortunately, half of it, about 1 centimeter, is breast cancer." So I spoke to my local oncologist, and who I love, Dr. Allison Wall, and we had a discussion, and she sent me to the surgeon to talk about options, and she also sent me to a plastic surgeon to talk about options. And then my husband and I went home, and we really had to digest all this because I wasn't hearing anything. You know, once you hear the C word, you're pretty much kind of overwhelmed. So it's really helpful if you have a family member or members that can provide support. So we came home and we thought about it. And while we didn't want to tell our daughter, we had to tell her. And she happened to be in Columbus, Ohio. And she lived 4 miles from Ohio State University, James Breast Cancer Institute. And she insisted that we come there because she wanted us to, number one, have a second opinion. And number two, she wanted to be a part of understanding what was going on, being there for whatever treatments were recommended in doctor's appointments, et cetera. So my husband and I drove up there, and we met with the doctor, and they scheduled a second surgery to remove a greater piece, which they call a margin surgery, and to make sure that all the cancer was removed. And while I was in there, they did something called a sentinel lymph node test, where they shoot dye into the breast and see if lymph nodes light up and they're affected by the breast cancer, and those would be removed as well. And one thing that had happened just before I got there is there was new research had just come out where you don't have to remove all the lymphs, but only the lymph nodes that are affected. So I don't have lymphedema or any problem moving my arms. I don't have to wear a sleeve, but a lot of people do. So anyway, I had the test, I had the margin surgery. The doctor there conferred with Dr. Wall here, and they agreed that based on the molecular makeup of my breast cancer, that 33 radiation treatments would be appropriate, but I did not need to have chemotherapy. Matter of fact, had I had chemotherapy, it was a good chance of leukemia. So I come back, my 33 radiation treatments, and by July of 2012, it's all done, and I'm thinking, okay, that's over with. I don't have to think about it, I don't have to talk about it. So my husband and I hosted a family reunion for his family here in July of 2014. And the day before his family was to arrive, we went to Walmart on Highway 49. It was raining, and I was coming in the door, and a guy was walking to the door with a mat to put down on the floor. And while I walked in, I slipped on the floor, went up in the air, came down on both my knees and shoulder. So I sat down for a few minutes and shook it off, and I figured, you know, I'll be sore for a couple days. And I just kept, well, the soreness never went away. Now there's months and there's days when I could barely lift my arm. I was in such pain. So I had gone to my primary care doctor and had 2 x-rays. And he said, Karen, there's nothing showing, there's nothing broke there. And so finally, it was March of 2015. Now this is July of 20. This pain that I can't figure out. And I went back to him and I said, something is wrong. And he said, okay, I'm going to schedule it for an MRI and we'll get the results and I'll let you know. So he gets the results. I go and see him and the color leaves his face. And he says, Karen, something's very wrong. Either you have a very bad infection or your cancer has returned. So I go and see Dr. Wall, and she arranges for me to have some scans. And they also checked, they did a biopsy with a long needle on my hip because the scan showed a spot on my hip. And sure enough, I had metastatic breast cancer. And metastatic breast cancer means that the breast cancer has left the breast and it has attacked another part of the body. So in my case, the molecular makeup of the breast cancer that left the breast and attacked the number 6 vertebrae in my neck, which is where the pain was coming from. There was a tumor here that had almost eaten up the entire number 6 vertebrae, the bottom of the one above it and the top of the one below it. So Dr. Wall sends me back and I confer with the local doctors here. And I called our daughter and she said, you got to come back to Ohio because I want to know what's going on. So we go back to Ohio. Now, these are 15-hour drives and we're staying in her little apartment, but we did what we had to do, and I'm grateful that we had the time and the resources to go back and forth. So I go up there, and the oncologist there gave me a little tablet called Letrozole, and he said, "Karen, I'd like you to take this tablet, and I want you to see the oncology neurosurgeon here." So I go and see the oncology neurosurgeon, and he said, "You know, Karen, I would really love to operate on you because that's what I do, but you don't have diabetes, you don't have heart disease, you're young and you're healthy overall. I want you to take a journey with me. So come back in 3 months and we're going to see what's happened with the cancer and the letrozole." So I go back in 3 months, and the tumor is shrinking. My pain is gradually reducing. And I go back, they check me again. They said, "Okay, come back in 6 months." So I came back in 6 months, and the tumor was at really small, and new bones began to generate around the perimeter of the bones. I don't have any pain from lifting my arm. And so I go at the 6 month checkup, and they showed pictures. So he says, "Well, the oncologist says, I want to add a bone targeting agent to protect your bones proactively from any further metastases." And he gave me 2 options. And so I chose the one that was very convenient. It's a shot once a month. And so that's what I decided to take. And I went on about my business, came back, no surgery, no further chemotherapy. And from 2015 to this day, I've had several scans, no new metastases. Everything is stable, and I'm extremely grateful for that.
Well, we're glad that you are here and to be able to tell your story and to help inspire other people. I do have a question. Between 2012 and 2015, did you have regular checkups? Like how is it able to metastasize without it going undetected? Don't you usually have to have like 6 month checkups, about 5 years after your remission?
Well, there's a couple things. Number one, from 2014 when I fell into 2015. So every year I would have mammograms. I never missed the mammogram. But from 2014 when I fell until March of 2015 when I found out the cancer had metastasized, I really believe that the cancer probably was there a lot earlier than I knew. Sure. And so the primary care doctor said in his own words, "I missed it." Oh. And so had I had a scan earlier. So the one thing I would say, first of all, metastatic breast cancer is not curable. It is treatable. And there are many types of wonderful treatment plans that are helping women all over the world. So they say that the average lifespan, once you become metastatic, is 5 years. Well, I'm past 5 years now, just a little bit, but still past 5 years and going strong. And so these treatment plans and the research that has continued over the years has really been very beneficial. But to answer your question, the primary care doctor, when I said that I had a fall and he knew that I had early breast cancer, the first thing he probably should have done was sent me for a scan of my bones.
Okay, well, now we know to be able to tell other people. And let me ask you this, did it run in your family? Does breast cancer run in your family?
No,
Is it just
there's no history of anyone in my family. I'm the first.
So that's why it's so important for you to have those mammograms or do the self breast exams. I get my mammogram, but I really am bad about the self breast exam.
I think that nobody really likes to touch their own breast, and after the mammograms, I think about it for about a week, and then I don't. I just forget about it. Just forget anymore, about it. But it really is important.
And the original breast cancer that you had, that was different than metastatic breast cancer, and you didn't have to have chemo or you did do chemo, you didn't do radiation.
I did radiation, 33 radiation treatments, and no chemotherapy either time.
Okay. And there's just for some people know that there is a gene that can be detectable that you can get tested for. I think it's the BRCA.
There is a BRCA gene that you can be tested for. So if it runs in your family and there's a high probability that you would be diagnosed with breast cancer, then some women do proactively have their breast removed. But I do want to say something about that. When you hear breast cancer, you're really overwhelmed. This is an emotional journey. And having your breast removed does not mean that the cancer will not metastasize. So it's really important, based on the makeup of your breast cancer, number one, that you get a second opinion, and number two, that you understand that removing your breast is not necessarily the solution for your particular type of breast cancer. And so I chose the least invasive route. So I have a little spot here that you would hardly even notice, and a little slit under my arm where they did the sentinel lymph node test. So I just want people to take the time to do their research. And the other thing is the cost of care is catastrophic. Fred and I, both of us were contractors. I had just finished my COBRA at my job because I had left the gaming industry where I was an executive. So I've just finished my 18 months of COBRA. My husband is a structural engineer in the nuclear power industry. So we were both hustling as contractors and having a great time. And neither one of us had any type of illness. So after my COBRA ran out, I bought a simple policy off the market. Well, then the breast cancer came. Well, the cost of the radiation treatments alone was $33,000, not counting any other tests, doctor's visits, medicines, et cetera, et cetera. Well, thank goodness for the Affordable Care Act, because now I have a condition that would preclude me under normal circumstances from getting any insurance. So now I got breast cancer. We get a robust policy. And my husband says to me, Karen, I need to find a job because the cost of care is catastrophic, and we're not really trying to be bankrupt. And so in his mid-50s, he was fortunate to be able to get a job with the government. And so now we have government insurance. But the cost of that was he took a job that was in Maryland. So he has an apartment in Maryland. We have a primary home here in Mississippi, and he works away 9 months a year, and he's home three months a year. But because of COVID, he's been here. He's been here since April because of COVID. All my girlfriends say that's a wonderful setup that he's only home 3 months a year, but you know. But I do like
and I probably would have a tendency to agree with, you know, I am single. That's probably why I haven't been married. So that's okay. Well, I'm glad that I know Fred, and I know your daughter, and I know they've been very supportive. So I'm glad to hear that you were able to make it through that financial journey. But just so you know, Karen was featured on CNBC.com, and I'm putting that in the chat line and on the Facebook page, just in case you all want to check that out.
Well, thank you.
Yeah, there's no problem. So what have you learned? What in terms of, you know, women needing to control their health? Anything you want to tell us? You know, even like
yes. It's really important. I think that as young people, as young women, we don't think about the future. And so things like smoking are not good for you. If you smoke today, there's going to be repercussions down the road. If you drink a lot of alcohol, it's one thing to have a glass of wine a day or a week or whatever, but heavy alcohol use is not going to be good. To keep a healthy weight, to do some walking, even with my metastatic breast cancer, and I'm always at some level of discomfort in my lower back and hips, partially because I have osteoarthritis in my hips, but also one of the side effects from one of the medicines that I take is joint pain. But 5 days a week at a minimum, I walk 2.1 miles, and I make sure I have my phone, so I'm tracking it. I make sure that aside from the cookies that I bake, that I eat healthy, and that is a lot of baked fish, a lot of fresh vegetables, kale and asparagus, Brussels sprouts. Broccoli is one of my favorites. I use a lot of herbs, olive oil and herbs to season my food. Even when I'm making greens and beans, I don't put, you know, like a lot of meat and stuff in there that's going to really, you know, put a lot of fat and oil in there that I don't need. But the way we live today is going to impact our lives tomorrow. And when I think back about all the crazy things I ate over the years, all the donuts, all the chicken wings, all the, there was a lot of, I was never a smoker. I was never a heavy drinker. And some of these things are just the luck of the draw, or it's in your family. But I just really think that people need to be very thoughtful and careful about how they care for their physical being. Drink lots of water too.
Drink lots of water. Okay, I'm typing things into the feed here so we can have it for prosperity for later. And this may be too personal, but how is Kristen, your daughter? Did I say that right?
Well, I'm glad you asked that question, because I think that family members are much more, well, in my case, we're all different, and Fred and Kristen they don't manage stress well. I am a person that multitasks and does lots of things, and they're linear and we're polar opposites. So I was really more worried about them than I was about myself. And that's the issue around your family members. It's hard for them because you're facing at some point mortality, but we all are. And so I just focus on, what can I do? I'm going to do all that I can do while I can do. And then if I can't do something, then I'll ask for help. But Chris and Fred watch me like hawks. They don't let nobody come in the house. This is during COVID. If I go outside and talk to the neighbor, they're like, "Oh no, put the mask on, stand on the curb."
That's right.
Yeah,
because that is considered a comorbidity. I mean, you are high risk for sure.
Absolutely.
And I don't know if you even remember this. I tried to remind you once before, but I was calling you in 2015 about something. I have no idea what it was, and you answered the phone. And you were a little preoccupied, and you said that you like, I literally just got off the phone with my doctor, and he told me that my cancer had returned. And I just remember getting off the phone and just crying. I mean, for the fact that, number one, you probably, like you said, were in a daze and probably didn't mean to answer the phone, and whatever it was, I was like, well, Karen, I'm gonna let you go, but it's so interesting how, full circle, here we are, another five years later, and we're talking about it, and I'm so glad that we are. And so let's talk a little bit about the partnerships that you've made, because of course you've become an advocate for breast cancer awareness screenings. And I'm going to admit Catherine Young, who is, like I said, the Senior Vice President for Susan G. Komen. So tell us about, your partnership with Catherine, in addition to any other resources on the Mississippi Gulf Coast that we should be thinking about utilizing.
Well, I didn't know Catherine at all, and she called me. She's like an angel, and she called me up and she said, "I'd like for you to be the Breast Cancer Survivor of the Year." So I asked her a lot of questions, and she is so calm and lovely and delightful, and yet effective in the way that she recruits people. So I did that, and then the next year, you get a taste of it, and then you're like, "Oh wow, this is really important." So then the next year, she asked me to be the honorary chair, and I asked her to reach out to Senator Bryce Wiggins' wife, Heather, who is also a survivor, and she got her to be the Breast Cancer Survivor of the Year, and I helped her raise some funds. Well, then she sent me to a meeting, an advisory board meeting at Susan G. Komen Dallas headquarters. So I joined the advisory board. Then she sent me an invitation about African American health equity to address the issues that you're speaking about, because many African American women are trained to be quiet, to keep health issues private. Well, this is breast cancer, and I'm telling everybody, and if you don't tell anybody, nobody knows what you have and they can't help you. And people don't necessarily look like there's something wrong. Mm-hmm. I remember when I went over to the Kroc Center, and Gary was there. He was so wonderful. And he said, "I was afraid to see you because I didn't know what you're going to look like." So people have this idea that, we're going to look like lepers. Well, there's a whole range of how we look. But anyway, back to Catherine. So she's got me plugged into all kinds of things now. So I've been on the advisory board. I'm the vice president of our affiliate chapters board of directors. I am a advisory board member for the African American Health Equity Network, all under Susan G. Komen. I help within My Own Voice, which is an annual event that focuses on survivors of metastatic breast cancer, and that's been hosted out in California twice, and then this year it was virtual. So I'm pretty clicked in, and when people call and ask me, "Will you speak?" I speak.
Good, because telling your story, I think it inspires people. I've invited her in. Catherine, if you're on, your camera's not on, so you have to click on your camera to view. But as in the event we're not able to, there we go. Hey, there she is.
Hi,
How
Catherine.
you doing? Good morning. So pretty good to see your pretty face. So you heard a little bit about the relationship that you and Karen have built over the years. Tell us a little bit about the resources that are available on the Mississippi Gulf Coast and how Susan G. Komen has helped raise funds. And what the wonderful thing about, I think, your organization is that you can see the measurable deliverables right away. I mean, within your community, oftentimes, and not knocking any other organizations. It's for research, and the research is good because that's what helps us bring about medications and different clinical trials and treatments. But it's so important for people to be able to utilize the grants and such that are funded by Susan G. Komen to be able to get that hands-on need, to fund mammograms and such like that. So can you tell us a little bit about what resources you have made available through the mission of Susan G. Komen on the Mississippi Gulf Coast specifically?
Thank you all so much for having me join you all this morning. It is a great honor and pleasure to be with you all. And Ms. Karen, thank you for such passionate words. Susan G. Komen has always dedicated our efforts into our communities. And what makes us so different is that we are so entangled into our community that being able to provide those necessary and needed resources in the community is so vital to us. We started with the Mississippi Gulf Coast in 2013. It was out of a need where one of our community profiles that was done back in 2010, 2011, noted that the Mississippi Gulf Coast had an unusual increase or high mortality rate for breast cancer disparities for the underserved population. So for us, it was a matter of action. So at that particular time, the Mississippi Gulf Coast was not one of our service area. We only covered 30 counties out of the central part of Mississippi, which encompassed only the Hinds County down to close to Hattiesburg. So when I came aboard in 2010, that was one of our missions, looking at the community profile and the need for expanded services that Komen offered. So in 2011, we began the expansion process to include the Mississippi Gulf Coast as part of our footprint in the Mississippi area. During 2013, one of our biggest efforts was to provide a walk. We wanted to test the waters and see how things and how everything would go. So we began planning for our Paint the Park Pink in Gulfport, a successful event that we had, and we've been there ever since. During that time, we also was able to connect with our Komen headquarters organization. And during that process, we were able to connect with Memorial Hospital, which is, of course, one of the biggest health systems, or one of the biggest health systems there on the Mississippi Gulf Coast. And during that, we were able to work with them to provide a startup grant for Memorial that was provided through Komen. And we will be able to sustain that as we go through the process of our fundraising efforts on the coast. So the initial grant was funded to Memorial from our national organization. And I think their initial grant was somewhere in the round of $60,000. So the goal for us was to provide the money for Memorial to provide free mammograms, treatment, medication assistance, and support services for underserved women on the coast. Because we know now from our community profile that underserved women typically wait until the breast cancer has spread onto other parts of the body before seeking care. So preventive measures and being able to provide that preventive measure for any woman who needed it was vital in our efforts to move forward and make sustainable changes and increase our efforts to make sure that no woman die of breast cancer. So fast forward, since 2013, we've been providing a grant to Memorial Hospital Foundation. Now we're at somewhere close to $200,000. and they provided countless mammograms and treatment assistance. We've been in contact with many women who have no other resources, did not qualify for the state breast and cervical cancer program, who had no insurance, and we were able to, through that grant, provide them with services and connect them to other resources that enabled them to get their treatment throughout their continuum of care journey for breast cancer. So Susan G. Komen has been a leader in the fight to create a world without breast cancer. After nearly 4 decades, we remain committed to doing everything we can to save lives, of course, and we cannot do it alone. We depend on our community partners. We depend on individual fundraisers who fuel our mission and make our work saving lives more possible. In 2017, I developed the first coalition in Mississippi to develop addressing breast cancer disparities. And what we know is African Americans are 40% more likely to die of breast cancer than any other nationality. So for us, developing this coalition of researchers, physicians, community leaders, faith-based community, we can address those systemic racism issues. We can address how we African Americans access the healthcare system. We can address our advocacy and policies that impact African Americans and women in general. And we can also look at our community and how our community plays a part in addressing breast health disparities. During our coalition, we developed a mission goal action plan. And a part of our mission goal action plan is to take segments of the state where we know high mortality rates exist. One of those being Adams County, near Natchez, Mississippi. During our one of our focal points in Natchez, Mississippi was to create a system where we can get women into a continuum routine of having their mammograms and also being able to get additional screening and diagnostic services that were needed that will be paid for through either a Komen grant or a community partner. And using that, we were able to write a journal article in the Journal of Cancer Education, which was published in the same year of 2018. We want to use that model to model that same effect on the Mississippi Gulf Coast, the Mississippi Delta, and other areas of the state which have high mortality rate. So those are the things that we've been working on and we'll continue to work on. We focus on metastatic breast cancer. We hosted a metastatic breast cancer conference down in the Mississippi Gulf Coast at Scarlet Pearl Casino, because we know that the majority of the women who die of late stage diagnosis also have metastatic breast cancer, which originated in the breast, but of course spread it to another organ outside of the body.
Sure.
So we want to focus our effort and on that as well. So hosting that event on the coast gave us an opportunity to learn more about metastatic breast cancer and how we can impact and give women the tools that they need for early detection and prevention in order to take control.
So how does someone go about doing that, Catherine? When you say that, obviously you have partners like Memorial Foundation, which I'm very proud to be a part of that Memorial, and then to be affiliated with Amy and Catherine and Harry, who run the foundation. But other than that, because you have to go through a caseworker, you become a patient at Memorial, you apply, things like that. Are there other partners that you have? Like, do they call Susan G. Komen and then you give the information? Is there something on your website? Like, how do we get the information out to people and how to utilize or capitalize on the services that you help support financially?
Memorial is the hub of the information. We do very seldom get calls from individuals that are on the coast that may not know about the services, and then we refer and connect with the individuals that are there. But the majority of the information is released by Memorial.
Okay.
They have a flyer, it's on their website. We also have information on our website of all of our grantees in the various different locations. So if you're anywhere within the state, you can click on our website and you can look and see where there are funding within the state and how you can access with phone number, websites, and things like that for those individuals. But the greatest pleasure that I do get are the ones who call me and we're able and they are don't know what to do and really want to help and having a connection with someone right at Memorial that we can actually get on the phone with and walk them through the process because we found that most women like Miss Karen said are fearful. Fear factor is one of the biggest things that keep women from going and seeking out care. So minimizing their fear and walking them through the process is the greatest thing that we as servers can do. And so being able to find this information, we want to readily get it out and available to people. Reason why we publish and try to work with our granting organizations to release as much information as we can. Another thing that I didn't mention was in 2016, the WWE World Wrestling Federation worked with Coleman and myself and Memorial in order to have a on live screening event right at Cedar Lake, I think, Clinic of Memorial. And we were very successful in that. And we believe that personal touch, when you have a personal touch and you can see people that truly cares about a person's care and how they get their services and care in a caring environment, gives them even more empowering and confidence that we can or you can go through this process and you have people here that are working in your favor to help you out.
That is fantastic information. And, I do not mind you plugging Memorial at all. And, I was trying to spread the love a little bit and pull in some other resources, but if we're the hub, we're the hub. So I have added the web address and the phone number in the chat feed on our Facebook page. So that people are happy to reach out and find out more information about that. And support groups, Ms. Karen, have you met other people that are living with breast cancer that you find support from emotionally?
People don't usually call me. However, they're just setting in my own voice group at Coleman is setting up a private Facebook page, and I'll be hosting that a couple times a month. But there are lots of Facebook where women with breast cancer have relationships. And also, Catherine mentioned clinical trials. It's very important that African-American people look into clinical trials because we represent about 2% of all clinical trials. And yet we're over 40% of deaths from breast cancer. So the more that we can learn about the makeup of African American and other people of color, the better from a research standpoint.
Why are we dying at a higher rate?
Well, there's a lot of reasons for that. Catherine, you want to chime in?
Yes, so based on our community profile that we just recently did in 2017, we can see a lot of things that contribute to late stage diagnosis of African Americans. One I mentioned was that fear. What I don't know won't hurt me type of mindset that most older African Americans have. And if they open me up, then I will surely die. So some of those common myths are one of our reasons. Of course, biological, we know that biologically we are, of course, our genetic makeup is a little different than other nationalities. The reason why clinical trials, as Ms. Karen said, is so important to be able to tailor treatment specific to those based on their makeup. So the more we participate in clinical trials, the better we're able to find treatment options that are better tailored to our needs. Economics is also one of the reasons why we have a more African American people that are of low income in especially in rural communities of our state and around the world. And so that impacts how a person accesses the healthcare system. And looking at our healthcare system, African Americans are viewed based on research differently than our white counterparts and other nationalities, which makes our systemic racism and things like that play a part in how we want to get care. So if we're not offered the same treatment options, treatment plans as other individuals, it hinders us from wanting to continue to obtain treatment and get those treatments. So it's a compound of a lot of issues with us. But I think the more we talk about it, the more we bring out certain issues, the more we impact our healthcare systems to look more broadly as to how we engage with African American patients and look at our culture and take in consideration how our culture impacts our health, then I think we'll be able to move the needle.
And I do want to add something, and that is typically there's more than one way to treat breast cancer. So with my breast cancer, there was more than one way for me to be treated to protect my bones. At one point, the cost of the care was so catastrophic that I had to switch to another one. But I went to the doctor and said, this is too much money. I can't afford to do that. Wow. And so and I have resources and I'm grateful. I've received excellent care here on the Mississippi Gulf Coast and when I had to go away. But the point is, if you don't talk to people, if you don't tap into those resources that you don't understand, and people that are in need, some of the pharmaceutical companies have programs where they will help. Some of the hospitals and have patient services offices where they can provide help based on your income. So these are things that people would know. And believe it or not, Kristen has a friend who the cost of care became so exorbitant, she just went to the doctor and she passed away. So these are real live stories of people that we know. Oh, wow. So I just want as many people to know as possible that yes, you can live. Yes, there are resources. You have to talk to people who know and can point you to those resources. And Susan G. Komen is a wonderful organization. Catherine's been an angel to me, and so have you, Angie Juzang, and the team at Memorial Hospital. So I am very grateful for all of the support.
Well, and we appreciate you. And I was going to ask if you had any final words or thoughts, but I think that might have summed it right on up. Unless you have anything, Catherine, you have anything you'd like to share? Any upcoming events?
No, nothing right now. We've just finished our virtual race on the coast, and we're just gearing up, going through National Breast Cancer Awareness Month, just encouraging people that although October is designed as National Breast Cancer Awareness Month, that it is still a 365-day-a-year thing that we should be aware of. So just be mindful that although this month is, take notice of your body every day of the year.
Absolutely, and I do appreciate you saying that. And we actually are going to do a breast cancer campaign throughout the year for that particular reason. And so that brings me to my closing thoughts. Then is that Memorial does offer a cash pay option for mammograms, which is $100. And so it's a special certificate for a 2D, and then a 3D, which is a little bit more involved and helps with better imaging, is $175. And there are opportunities for the Memorial Foundation or our organization to provide assistance for that. So to Ms. Karen's point, if you got to ask a family friend member, somebody, you can pay cash for that. You have to have a doctor's order, so you'd have to have a primary care provider to put the order in for the mammogram, but it's right there on our website, and wearememorial.com. And I did not set out to plug the organization a little bit that I work for, but I am glad that the Legacy Business League has a partnership with these type of industries, so we can bring you this information. So I think that is going to do it for today. I hope that one day we'll be able to check in with some other exciting things that y'all have going on. And whenever you have your forums, Whenever you have some events happening, please send it to us so we can post it to our Facebook page and get it out to the people that participate in our Legacy Talks.
Thank you.
Okay, y'all have a good afternoon.
Thank you very
Stay safe
much.
in the storm.
Thank you.
Bye-bye.
All right. Thanks.